Welcome to the first of 2 Halloween-themed episodes on my YouTube channel. Today we're going to be talking about the dark side or danger of antifungal, particularly medications. Now, could this overlap slightly with the herbal world? Maybe. I don't think that's as well established, but I want to talk about this because I think it's actually a pretty common issue, and I wonder if we're doing more harm than good. Now, I want to also say, A, this is probably going to be a long one, but B, usually I kind of take you through the science, and then at the end, we do a little executive summary, big picture takeaway moment. I'm going to start with the big picture first, then get into the science, and then we're going to talk about the big picture takeaway again at the end of the video. Because I want to prime you for this with an analogous situation. Hopefully by now, recording this in 2022, hopefully we all know that the overuse of antibiotics is a huge, huge problem in the world. We're getting antibiotic resistant bacteria left and right. We're seeing an increase in things like C. diff. And honestly, we're going to run out of antibiotics that we can use if we keep up this track. Now, this was a really big problem in like the 80s and 90s when I was growing up, and I could attest to that. I had boatloads of antibiotics growing up. But surprisingly, I've heard many stories, and I have my own, where like somebody went in to their doctor or urgent care with what clearly was a viral infection, absolutely no need for antibiotic, and they were not seeking antibiotics whatsoever, and the provider still wrote them a script for antibiotics. So antibiotic overuse is still a big problem, even in 2022. The general gist of why we talk about this is that A, the bacteria that don't get killed off can then adapt, and they can develop methods of resistance to that drug. So for example, I don't know, in this weird scenario, I'm a bacteria, you come in with a bunch of penicillin. If I survive through a biofilm or whatever other mechanism, if I survive, I might remember that penicillin and I might go, ooh, I need to change ever so slightly. I need to adapt and tell my friends around me to adapt so that if that comes around again, I'm not going to get killed by it. So that's where the antibiotic resistance issue comes in. The other issue that we see a lot with the gut microbiome is that some bacteria are more vulnerable to antibiotics, and some bacteria can recover much more quickly after antibiotics, right? So like you kill off the bad infection, say Streptococcus, but you're also decimating your good bacteria like bifidobacteria, lactobacilli, probably some of your butyrate producers. So you're knocking them down a few pegs. And then the key is that they don't recover very quickly. It might take months or even a year for them to really recover their numbers to what they were prior to antibiotics. In the meantime, there are other bacteria, unfortunately not as friendly typically, that bounce back and recover pretty darn quickly. And they can take up the space of what was once there. So that's a good example of that is C. diff. You knock back all of your protective bacteria, you create this insufficiency dysbiosis, and then the C. diff is able to replicate and rebound much more quickly than, say, the lactobacillus. So it expands and it takes over, and then you've got yourself a C. diff infection. So all of what I just told you, A, is not related to fungi necessarily, and B, is probably not new news to any of you. But here's the thing. If we have a problem going in a little bit willy-nilly, and knocking out all sorts of bacteria, and we're mindful that there are good bacteria and bad bacteria and middle-of-the-road bacteria, and we're just wiping them all out, why aren't we having the same conversation with antifungals? And that's where I have 3 studies that I would like to share with you, because I think that the role of the microbiota, so the fungal microbiome, if you will, is an emerging and really important link with not only irritable bowel syndrome, but probably numerous other health conditions and symptoms as well. So hold on, let me go ahead and give myself a head bubble. And this is arguably one of my favorite papers in existence. It's 2016, so it's still a little bit of an oldie but goodie. Immunological consequences of fungal dysbiosis. Ooh. And basically what they did like 3 or 4 layers to this study. Basically, first they took healthy wild-type mice and they treated them for 3 weeks with fluconazole, a very commonly used prescription antifungal drug. And what they noticed was that these mice had an increased frequency of inflammatory immune cells during that fluconazole treatment. And they thought, oh, that's weird. And like they were testing to see if the fluconazole treatment would protect them from colitis when they intentionally induced colitis, and it did not. The mice treated with fluconazole actually had more severe colitis than the mice who were not treated with fluconazole. And they even said in the article, they were like, much to our surprise, the opposite was true. They were not anticipating this. They actually, they went in with a hypothesis and it proved to be the complete opposite of what they expected. So then they were scratching their head and they said, well, let's look at the same thing from a different angle. So they took, again, wild type mice treated with fluconazole in the drinking water, I believe again for 3 weeks. And then they looked, they basically tried to induce an allergic reaction. So they, I think they used the word immunize. Oh my God, why is that hard today? They basically immunized or inoculated with dust mites in the airway, and they were trying to cause airway disease or allergic disease. And lo and behold, the mice that were given fluconazole had much more severe airway disease and allergic disease than the mice who were not treated. They also noticed that the mice who were treated with fluconazole first had an elevation in Th2 associated antibodies, IgE, which is the antibody of the allergic response, and an increase in Th2 cytokines like IL-4 and IL-5. And if you guys have watched my videos about histamine and mast cells, you might recall that Th2 cells are the T cells that basically tell the mast cells to go berserk. They typically, their activation will lead to more histamine, more phlegm, more mucus, more antibodies, more allergies. I would argue also more food sensitivities. So this is generally not a part of the immune system that we want to, we don't want to increase its activity, generally speaking. And then they also tested 2 other antifungals for that matter, and they basically saw the same thing. They said, oh, when we treated them with other antifungals, basically same issue, Th2 polarization, much more severe allergic airway disease in those mice. Then they said, well, let's see, let's look at the fungal microbiome and see what we're looking at here, because they noticed that there was a 3 to 5-fold reduction in the total amount of fungi, but it wasn't wiped out down to 0, which made them think that the fluconazole treatment most likely was acting on one or several specific fungal species, but it was not working on every single fungi in the ecosystem. And they were right. They said, yes, there was a decrease in Candida species, which is obviously the one that we talk about the most, but other fungal species like Aspergillus, I wrote a note so I won't forget it, Wallemia and Epicoccum expanded in the treatment. So it sounds mighty similar to what we see with antibiotics, right? You knock down the bad guy, say strep, if you have strep throat, you knock down the bad guy that you were aiming for, and that's good. You might knock down even a couple of others, but you're also allowing for the expansion for some other fungal species, which may or may not be a super great thing. And then, like, I could just kiss these researchers. They are brilliant human beings. So then they took it one step further. The 4th part of the study, they said, all right, well, maybe the fluconazole is doing something else entirely, and that's why we're seeing these things. Maybe it's not the fungi at all, right? Like maybe fluconazole is pro-inflammatory in some way, or immunomodulatory in some way, or maybe it does something to hormones. We don't know. But we want to see, is it the fungal dysbiosis that is inducing this allergic Th2 type response? And it was. So what they did was they took the dysbiotic fungi, right? So less Candida, but more of the 3 that I just stated. They inoculated wild type mice with that fungi or that fungal concoction. And then they measured stuff and they found same frickin' thing. Increase in Th2 activity, increase in IgE, Th2 cytokines, the whole kit and caboodle. So it's pretty clear that knocking down Candida that aggressively can possibly be a bad thing. And maybe we've been after the wrong thing. Maybe it's not the total amount of fungi or the total amount of bacteria if you have SIBO, for example. Maybe it's the dysbiosis that we need to be caring about much more. But the thing is, we don't know as much about fungi. This is all pretty new. Like, really, interest in the microbiota has only been starting to take off in the last maybe 5 years. So I think that it's still in its infancy. But we certainly have some takeaways, which, in my opinion, the takeaway from this paper is only use antifungal prescription medications when you absolutely have to. Now, I've taken those before. Like when I was last prescribed an antibiotic, I asked for a prescription for fluconazole because I didn't want to be, up the creek without a paddle if I got a vaginal yeast infection from the antibiotics I was taking. So I do think it's reasonable to maybe co-administer this with an antibiotic on occasion. But if you're finding that you need to do a lot of antifungal treatment, or heaven forbid, if you go to a integrative or naturopathic or functional medicine doctor and they are a prescriber, so they're MD, DO, nurse practitioner, physician assistant, or a naturopath in a licensed state, if they say that part of your IBS SIBO dysbiosis treatment is to take fluconazole, I would just print this paper and show it to them. I would say, no, can we please do like caprylic acid or reducing sugar intake? Can we do something else? Because I find, surprisingly enough, that a lot of the integrative folk out there in my field, the ones who are prescribers, are all too happy to give you a fluconazole treatment, potentially for weeks or months, as part of a treatment for dysbiosis or SIBO. And I mean, I don't think that's a good idea. I really don't, especially for that duration. But moving on, you might be thinking, okay, cool, lady, like this was in mice, but what does that mean for me, a human? Well, there's 2 papers that I wanted to show you regarding humans. This one's relatively new, about 2 years old. Gut fungal dysbiosis and altered bacterial fungal interaction in patients with diarrhea dominant irritable bowel syndrome. Now, the first thing I will say about this particular paper is that it was small. So if you look at the methods, they had 55 IBSD patients and 16 healthy controls. So I will say it's not huge, but it's something, and at least it's humans. And I'm going to do something I haven't done in one of these videos before. I'm just going to pull over my notes from the other screen because the names of these fungi, if I try to say them, it's not going to be pretty and you won't know what I'm talking about. So I'm just going to pull over my notes because when I go through research articles like this, what I typically do is I start a Word document on whatever the topic is and I put it in a folder and I start saving all of the PDFs as I go through them. But I usually go in and I harvest out quotes or significant parts of the text and I highlight and make notes. So this is what my notes look like for this particular paper. And I highlighted a few things to point out. So what they noticed was that, first of all, IBS patients could have a IBS dysbiosis type microbiome. So again, bacteria in this time, or they could have normal, healthy-like microbiome profiles. These are the people with IBS. So it was a mixed bag. Some of the people with IBS had what this group would label as dysbiosis. Some of the people with IBS had a fairly normal-looking microbiome. Interesting. Then they did say fecal fungi showed significant correlations with IBS symptoms. This is where I'm not even going to try to pronounce these because I will just embarrass myself. Or heck, I'll just give you a laugh. Mycosarrelia, Aspergillus, and Sporidiobolus. You're welcome for the laugh, by the way. Feel free. And Pandora. Oh no, we opened Pandora's box. Which were identified to positively potentially differentiate IBS from healthy controls. All right, there's a handful there. They noticed that there were fewer or different interactions between the bacteria and the fungi in the IBS patients, which I found interesting. Because again, it's all relationships. That's what dysbiosis largely is about. Here's another one: weaker gut fungal association with bacteria. And then here's a couple that I thought were interesting to share. Enriched candida, so elevated candida in IBS-D patients, was associated with more severity of bloating and anxiety. Reduced, oh gosh, Debaromyces, good God. Reduced Debaromyces was accompanied with more frequency of defecation and longer course of disease. A positive correlation between Sporidiobolus bolus and frequency of defecation was shown in IBS-D patients. So again, we've got two that you probably have never heard of. Everyone's heard of candida by this point, right? You know what candida is, so that one probably doesn't surprise you. But I bet you haven't heard of this one or this one because honestly, I had not. And maybe those have some interaction here. Then, hold on. There was some more to it, but that was the highlight for me. This was a really good paper, and this is pretty fresh off the press. I'm recording this in October, again, obviously the Halloween theme, and this was only posted this year in August. And likewise, I'm just going to drag over my notes and make my life a little easier. I'm not going to give you the illusion I have all of this memorized, because I don't. So similarly, though, if we look, they were comparing IBS patients with what they considered healthy controls or healthy normals. They said IBS patients show less fungal and viral diversity, but some alterations in microbiome, virome, and archaeome, such as increased abundance of Candida albicans. Again, that one doesn't surprise you. The virome, by the way, that's like a whole nother one that I want to unpack on this channel one of these days, but right now I just don't have the expertise to speak on it. Going down, at the species level, Candida albicans and Candida glabrata increased while Candida parapsillosis, this one, all of these decreased in IBS patients. Again, like maybe some of these are protective in some way. We don't know. Clinical studies have found that the one starting with a Z, I'm not going to try, is positively associated with abdominal pain, while the one with an M, I'm not going to try, is inversely associated with it. That means the more of the M1 that you have, the less abdominal pain you have. And if it's associated, positively associated, the one with the Z, the more of it you have, the more abdominal pain you have. Interesting. Candida positively correlates with severity of bloating. We just talked about that. Frequency of defecation is associated with these guys. These are the ones that I just mentioned from that other paper, and they threw in one additional one. Additionally, stool consistency seems to be inversely correlated with these two, which again, I'm not going to try. Notably, they speculated if food intolerances are related to Candida. One study indicated that overgrowth with Candida might cause food intolerance, while others suggest that there's no conclusive links. So that was a little bit of a crapshoot, pun totally intended. And again, you could tell I take a lot of notes, but let's see. Yeah, this was interesting. So this one I can't pronounce. Restores the density and diversity of intestinal bacteria to promote intestinal balance in an antibiotic-induced diarrhea mouse model. So again, that one might be protective in some situations. And then last but not least, Saccharomyces cerevisiae, the one that I know how to pronounce, is another commonly reported fungal probiotic for IBS that significantly alleviates abdominal pain, stool consistency, and bloating in patients. And they give a couple links. Interestingly, Saccharomyces cerevisiae has great degradation properties on fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, aka FODMAPs, revealing its ability to improve bloating. Well, I'll be. How many of you guys are restricting FODMAPs because they make you bloated? Maybe you just need some Saccharomyces cerevisiae, eh? For IBS patients, a mixture treatment containing beta-glucan is capable of relieving bloating and abdominal pain. Neat stuff. And they think that beta-glucan is one of the many constituents in fungi that makes it therapeutic or immunologically active. So all of that just threw at you. Now let me bring my head back. So takeaways, right? Like I told you, I'm going to give you the overarching theme. that fungal dysbiosis might be a thing, and it could very well be induced by antifungal drugs. And I'm not trying to be a meanie here, but like I feel like especially my profession, but to a some degree, all of us are a little bit hypocritical when we cringe and roll our eyes at the medical profession for overprescribing antibiotics, but we're not having the same cringe or eye roll with the overprescription of antifungal drugs, right? Like we can't laugh at one and then be okay with the other anymore. We have evidence that says that that they're not that different, I suppose. Now, again, the thing is, we don't know a ton about the fungi other than Candida. Candida does have a genuine decent amount of research on it at this point, but we don't really have that much great information about a lot of these other fungal species. So part of this is we have to watch and wait, and we have to see what comes of the research as it progresses. I think the other thing is, again, don't overuse antifungal prescription medications. I'm personally much more comfortable doing the herbal route, especially if it's like food-based or quasi-food-based and it's in moderate doses. I'm not really comfortable using oregano at super, super high doses, even though it is an antifungal and it is food-based in a sense, but there's no diet on earth that would have you taking the equivalent of 5 ADP tablets 3 times a day. Looking at you, Becker, with that one. So like, I think that even the anti-candida, antifungal herbal medicines need to be used with a little bit more caution and respect. The things though, like caprylic acid, monolaurin, SF722, I've talked about those before. I think that those are generally pretty okay. And like they mentioned in that paper, things like Saccharomyces cerevisiae, Saccharomyces boulardii, which I kind of skipped over because everyone's heard about it at this point, or beta-glucan, like those are things that you absolutely could get as a supplement or potentially through food even. And I think that could be a more holistic way to go and a more gentle, safe way to go about this. But if there's any one single takeaway from this video, just don't overuse antifungal prescriptions if you can get away with it. Try to go the natural route, try to go the holistic route as much as you can. And otherwise, just do things to promote your own bodily health. Because keep in mind too, things like Candida get a chance to attach much more aggressively if the gut is inflamed and leaky. So things like leaky gut are still on the table. In my opinion, both bacteria and fungi can overgrow if there's a stagnant condition in the gut, aka poor motility. You want to regulate pH, so things like HCl and bile and enzymes could still be allies to you. There are a lot of antifungal herbs, some of which are pretty food-based, so you could always go about that. Restricting sugar and keeping it to a relative minimum never hurt anybody. There's a lot that we could do to try to promote fungal microbiome health and bacterial microbiome health without obliterating all of the bad guys. And again, if you get prescribed antibiotics, by all means, take 1 dose of fluconazole, but I would hesitate to take more than a couple days of the stuff personally. All right. I feel like that was a bummer. I'm sorry if it was a bummer, because again, I know that these medications seem like a really quick, easy, effective way to get relief. And occasionally they can, but I just wonder if it's worth it. And really your goal watching this, I assume, is to feel better for a very long time, not just temporarily. So a little bit of a bummer perhaps, but hopefully the Halloween theme, the dark side of antifungals, was at least amusing in the beginning of the video, and I will see you in the next one. So I have one more Halloween themed video, which is going to be coming out next week before Halloween. And then after that, I'm pleased to say, we're going to get into not 1, but 2 videos exposing the GI map. I had to wait a little bit to get some more data collection in for one of the videos, but I'm ready. I'm going to start recording them soon, and I'm pretty pumped. So if you haven't subscribed already, please do. Comment down below. I do generally keep an eye on the comments for the first day or so of a video posting. And then after that, it's hit and miss for me personally. But say hi in the comments, or if there's anything that's helped you with your fungal overgrowth or your fungal symptoms, please let us know. Everyone would appreciate that in the comments. And also, I'm curious, do you have any stories about a time where you were prescribed an antifungal drug and it made you feel worse, or you feel like it maybe deterred from your health or detracted from your health rather? Or have you been to an integrative, functional, or naturopathic doctor who prescribed you weeks or months of an antifungal drug to go along with a dysbiosis or a SIBO protocol? These are all things that I would love to hear about in the comments down below, and I'm sure other people would benefit from reading your comments as well. Like I said, I'll see you in the next video for one more Halloween themed video, and then the exposure of the GI map. Hey guys, if you like this video, be sure to subscribe, ring the bell, click the like button, and leave a comment down below with the videos that you would like to see me do next. Doing all of those really helps support the channel and support my efforts in making as many videos as possible for you guys. Thanks so much, and I'll see you in the next video.